Hi, and welcome to the VieSID Press-release. In this video, we report on articles selected from the dental literature published in February 2023 that we hope might be of interest to the VieSID community. So let's begin. In the Annals of Anatomy, we found the paper by Ting Tan et al., where a rat model was used to test effects of food hardness on condylar remodeling. They considered 18 adult rats and divided them into three main groups. One group received complete Freund's adjuvant, in red in the image, which induced an inflammatory response causing osteoarthritis of the TMJ. One group received complete Freund's adjuvant followed by link-N therapy in green. Link-N is a peptide with growth factor-like properties favoring the healing process. The third group was the control group with healthy joints. Each of these groups was further divided into two groups, one fed on hard food and the other on soft food. Micro-CT scans were performed after 2, 3, and 4 weeks after inducing osteoarthritis to analyze the bone volume fraction, bone mineral density, and other parameters representative of the trabecular bone. The condylar surfaces were compared to assess surface alterations, both bone apposition and resorptions. The arthritic condyles showed alterations such as bone cysts, bone resorption, and other irregularities. Articular cartilage was destroyed and replaced by fibrous tissue. This is one of the plots representative of the author's results. In particular, this shows the bone volume fraction, which in all groups, control, complete Freund's adjuvant, and complete Freund's adjuvant followed by Link-N, were always higher for the groups fed on a normal diet. The authors noted that feeding the rats with our food helped the healing of the bone, improving the outer appearance of the condyle as well as the inner structure. Even under inflammatory conditions, the joints subjected to a higher mechanical load maintained a more regular, smoother surface, while in some cases the condyle of rats fed on soft food formed irregularities and spikes that caused even disc perforation. Although this can be considered a pilot study based on the small sample size for each of the subgroups, I think it provided interesting insights into the importance of mechanical stimulation for healthy joints. Community Dentistry and Oral Epidemiology published a special issue containing the proceedings of the 2020 Behavioral and Social Oral Health Sciences Summit, which had the aim to promote oral health globally by advancing the robust application of behavioral and social sciences. This issue is focused on four main topics: behavioral and social theory and concepts, extending into the issue of inequities and oppression in oral health research. Methodological issues, including operationalization of conceptual models into etiological research, causal inference, qualitative research, structural determinants of health, such as social, economic, and political mechanisms that generate social stratification with health consequences. Intervention science, delineating aspects of feasible and effective behavioral and social interventions for oral health to contrast inequalities and inequities. And dissemination and implementation science, providing examples of implementation or the implementation initiatives to improve oral health on a regional scale. As its outcome, the summit allowed reaching a consensus statement on future directions for the behavioral and social sciences in oral health. Mueller and colleagues published a review on the efficacies of acupuncture in the management of acute dental pain. This paper is to be found in the Japanese Dental Science Review. The authors aim to assess acupuncture efficacy compared to other pain-relieving approaches in the treatment of acute dental pain in concomitance to dental treatment. Eventually, they considered 23 articles which tested acupuncture versus placebo acupuncture, acupuncture combined with local anesthesia versus local anesthesia only, acupuncture versus local anesthesia in relation to consumption of analgesics, and analgesic medication with and without acupuncture. The results of this review show the potential role of acupuncture in improving acute dental pain intraoperatively and postoperatively, as well as improving the efficacy of local anesthesia. In particular, of the 23 articles, 11 reported on postoperative pain and showed that patients who received acupuncture presented lower pain scores postoperatively compared to sham acupuncture. However, the authors commented that the validity of the results is limited due to methodological shortcomings, pointing out to the necessity for new, higher quality research. The Journal of Craniomandibular Function published a paper by Serrano Hernandez and colleagues testing the response of 30 adult individuals with healthy joints to palpation of the lateral pole using different pressures, alpha kilo, a kilo, and 2 kilos, which were calibrated using a palpometer and tested both in relaxed mandibular position and in maximum protrusion. Patients' feedback indicated increasing sensitivity and unpleasantness by the weight exerted on the lateral pole and by the length of the pressure, which could be 2, 5, or 10 seconds long. Additionally, the authors found that 1/3 of the patients reported referred pain with increasing frequencies when weight and length of pressure increased. The authors concluded in agreement with the recommendations of the diagnostic criteria for temporomandibular disorders, suggesting a palpation weight of alpha kilo for the lateral pole of the condyle and of 1 kilo for around the lateral pole. However, given the fact that it elicited pain or unpleasantness in 25% to 50% of the healthy sample considered, meaning 8 or 15 out of 30 individuals, I wonder if the most cautious weight of 200 grams suggested by VieSID would instead be preferable. The Journal of Oral Rehabilitation posted an article by Choosen et al. On the association between gastroesophageal reflux, missing teeth, and masticatory dysfunction. They carried out a census of the elderly from a rural area in southern Brazil, including 489 subjects, with an average age of 71 years. The prevalence of gastroesophageal reflux disease is high in this group, corresponding to 37%. The BMI indicates that 66% of this population is overweight or obese, with 23% prevalence of diabetes mellitus. Since this group of people presented also a higher rate of tooth loss, the authors wanted to address the question of whether high gastroesophageal reflux disease was associated with the oral condition. While they didn't find an association between the presence of fewer than 20 teeth and gastroesophageal reflux, they found a significant association with difficulties in chewing cereals, as well as meat and fruit and vegetables. Although gastroesophageal reflux is a complex multifactorial disease, these findings are of interest because they hint at the importance of efficient mastication for healthy digestion, as poorly chewed food may delay gastric emptying and favor the development of gastroesophageal reflux disease. The Journal of Oral Rehabilitation published a consortium paper by Nilsson and colleagues containing the informed recommendations for the diagnostic criteria for temporomandibular disorders adapted to children between the age of 6 and 9 years. The diagnostic criteria for temporomandibular disorders are conceived for adults. Therefore, in this paper, the authors presented a global Delphi study with experts in TMDs and pain psychology for adaptation or simplification for using in children. Proposed changes in Axis 1 included adaptation of the language of the demographics and the symptoms questionnaire to be developmentally appropriate for children. Adding a general health questionnaire for children and one for their parents. Replacing the TMD pain screener with the 3Q TMD questionnaire, which contains 2 questions about pain in the temporomandibular area and 1 question on jaw dysfunction. Modifying the clinical examination protocol. Proposed changes in Axis 1 included for the graded chronic pain scale to be developmentally appropriate for children, but also adding anxiety and depression assessments that have been validated in children, and adding 3 constructs like stress, catastrophizing, and sleep disorders to assess psychological and psychosocial functioning in children. In the Journal of Prosthodontics, we found a review article by Goodacre and colleagues on non-carious cervical lesions. The authors performed a PubMed search and synthesized information about morphology, progression, prevalence, etiology, and pathophysiology of non-carious cervical lesions, and finally proposed clinical guidelines for restoration. Non-carious cervical lesions form a smooth saucer-like depression, like in the photo on the left, or V-shaped notches on the right. Variable prevalence have been reported ranging from 90% to 10%. Etiologies include excessive toothbrushing and an acidic diet, but publications have both supported and challenged the concept of abfraction, whereby occlusal factors leading to excessive loading of the teeth have been proposed as factors playing a role in the development and progression of non-carious cervical lesions. As non-carious cervical lesions are considered one of the most common demineralization diseases in the body and represent a progressive condition, conservative treatment through prevention is recommended, while restorative treatment is delayed as long as possible. When treatment is needed, composite resins are commonly used with proposed restorative guidelines, including abrading the sclerotic dentin, beveling the enamel, considering the potential use of mechanical retention, a 30 seconds long acid etching, and use of either multi-step or single-step adhesives in conjunction with a light scrubbing motion for 20 seconds without excessive force placed on the disposable applicators. In the image on the left side, you can see also silver diamine fluoride used on cervical lesions to arrest caries. And on the right, a light polymerized radiopaque calcium hydroxide base placed in the deep portion of the lesions to protect the pulp. I want to thank Ian Tester for providing me with insightful comments on this paper. We come to the end of this presentation. I invite you to contact us in case you want to know more about our activities. Otherwise, be ready for next press release. Best wishes to all.